This is our poor neuron that has that traumatic event. Obviously, the first things that are happening is that excitotoxic release. At the same time, the brain activates our innate immune system, our microglia. And there's inflammation that starts happening right away. You can see the cytokine soup that's happening. And that at the same time, that excitotoxic release from glutamate is triggering the calcium. Calcium is flooding inside of the neuron more than it ever should be, counterbalancing a lot of the other electrolytes like magnesium and potassium, and ultimately flooding the mitochondria. So really a lot of, and I'm sure Cam's gone into this in detail, so much of what a concussion patient is experiencing is an energy crisis. And the mitochondria are really the power plants at the cellular level, at the subcellular level, that really are responsible for producing that energy. We all know that. But there's a couple things that as we now progress, that patient may get into that kind of post-concussive syndrome. They're part of that unlucky 10 to 15% that go into a state of immunoexcitotoxicity and neuroinflammation. These are the kind of two concurrent things that are happening, as I mentioned just on the same slide. And I just want to kind of, you guys have that again in the back of your mind, because understanding the whole reactive oxygen species cascade and the inflammatory cascade, what can we do to offset these effects? They're happening right away. Some people can deal with them and they don't move on to post-concussive syndrome. The unlucky 10 to 15% can't, and they go into post-concussive syndrome. So again, I'm a visual guy, so just so you guys kind of see what's going on. Microglia, they're kind of like the watchmen of the brain. They kind of hang out patrolling for any sort of invaders, bacteria, viruses, but they are triggered and activated. So they're really, really easy to be turned on, but very difficult to be turned off. And that's what happens from a more kind of a chronic inflammatory perspective, as I just said, neuroinflammation. And obviously damaging the mitochondria and all the things that come with it. So we know inflammation, and this is being, at the sake of maybe being overly simplistic, but this is the way that I really explain it to patients. You have inflammation happening in your brain right now, especially in patients that are really not getting better. We know that inflammation is a problem with all chronic disease. We know it's a problem with Alzheimer's disease, and now that's becoming a huge issue with the baby boomers. But when it comes to TBI, we know there's inflammation happening. And that's the way I tell it to patients, very straightforward. We know that after TBI, markers of inflammation go up. hsCRP, etc. They go up in the serum. We know that there's inflammatory changes, as we just saw happening at the cellular level. We know that inflammation has a huge role to play with healing in general, or the lack thereof. And we have some evidence now, which I will get into as we progress through the presentation, that a specific diet can impact inflammation and can change the outcomes of inflammation, change the processes of inflammation.